concept that I've been explaining lately to other doctors and to patients that I've kind of noticed for years, but haven't gotten a chance to publish about because I don't publish anything anymore, is the coloration that you get in the skin from various types of fillers. In the past, the only thing that was discussed was something called a Tyndall effect, which is a blue type of refraction. It's not really birefringence, it's just refraction that gets reflected back to the eye from filler. And true Tyndall is pretty rare, but they would see it kind of in the under eye. Now, the areas that I want to discuss are the under eye and the lip, and what you see with fillers and what kind of filler. So in the under eye, when you inject fillers, it's a hypersensitive area, and I've mentioned this before. Anything under the pupil or the iris, so the entire colored part of the eye, anything underneath that is in a very hypersensitive area, and if you're going to inject there, you really try to do as deep as possible and as small as possible, and kind of hope that it doesn't draw in water in the future. So one type of discoloration you get from any kind of filler, the two types of fillers that we use in the under eye responsibly are Restylane and Belotero. You do not want to use Volure, Volbella, Voluma, Juvederm, Restylane Lift, Restylane Refine, Define. You don't want to use any of those. No Teocel, no Revenus Versa, nothing in the under eye except for Restylane, plain Restylane, or Belotero. And there's a lot of reasons for that, and that's a pretty certain thing. So I would be very cautious to go to anybody who would inject anything different there with any explanation they can have. This is one of those times where I would say there is, at this point, no exception. As much as I say sometimes there are exceptions to the things that I say, there is no exception. So it's only Belotero and Restylane in those areas. And when you do it, every time we just hope that it doesn't cause impairment in lymphatic drainage, which can cause water accumulation under the eye, or superficial migration where it can move superficially under the skin, and you get a couple different things. So what do you get when the good fillers even go superficial is you can get a bluish or yellowish tinge under the skin. Over here usually is where it happens, in the central part, although it can extend medially as well. And you get a little different blue in there from venous congestion. So the veins that come and drain here at the junction of the at the orbicularis and the cheeks, so the lid cheek junction, there's veins that dive in deep towards the orbital septum, towards the orbital rim. Those veins get engorged because their outflow tract is being blocked or restricted. So when that happens, you have to go back and do a little bit of dissolver to minimize it. Now, the ones that cause the big problems, the biggest culprit for under eye filler by far is Juvederm, and that causes a discoloration in this kind of, it gives it a white crystalline appearance or a bluish light white crystalline appearance, and it can be just boggy and water retaining all under the eye, and that's a pretty nasty look, and it can last about 10 years plus. So these fillers, when they're in the wrong place, they last about 10 years. That's Juvederm. It shouldn't be placed in the under eye, and when it is, it lasts about 10 years, so you can dissolve it to try to minimize it. Then you have the worst of all under the eye, and that's radiance. Anybody who puts radiance in the under eye, the radiance is a calcium hydroxyapatite crystal, and it'll draw in water. So now you don't get a discoloration, you just get pure water, and they look like they have allergies. So that's a different color now. The allergic look means you look kind of boggy all the way across, and they end up forming malar bags over here from the filler, and you can't dissolve that away. It doesn't ever go. So radiance is pretty much permanent, and it will screw you for life. Voluma is similar to Juvederm. It'll give you that discoloration as well. So when you see, okay, I had my fillers placed, but I feel like my eyes are darker now, and you see there's a bluish color or yellowish color, it's because the fillers are drawing in water and they're reflecting the light of the crystal part of the filler, the gel itself, and the water that's being drawn into it, plus the venous congestion. Now to the lip. So here's what people don't see about the lip. So I was speaking with Dr. Harris recently in England and London. He has a great classification for filler movement up the lip, above the lip, and in my experience, I've told everybody that filler movement has different patterns based upon the injection technique of the surgeon plus the filler type. So the filler type that seems to move the most is Juvederm, and although it doesn't happen to him, I do bet that the patients he sees that have the 1 centimeter migration all the way up here, I'm pretty sure that they've all had Juvederm. So although it may not be in his hands, in other doctors' hands, the one that moves certainly would be Juvederm, and it crawls up here 1 centimeter above the vermilion. The color change you get from that is white. It turns a whitish color in this area over here, and it turns out to be a little bit of a bulge, and he's been seeing the same things, and a lot of other observant doctors see the same things, that there's a bulge there. When you smile, it limits your muscle movement, and the thing a lot of doctors aren't seeing is that it's an obvious change in tone as you come down from skin. So when you're alive, you have pink in your skin, and that's the blood supply of the capillaries in the superficial skin. If you push down on it, it kind of turns white for a second, and you get capillary refill, so the capillaries refill. In this area over here, 1 centimeter above, when you have Juvederm, it turns white and maybe a little crystalline, just like the under eye. And that stands out to people, especially when people smile and do this, and you get a bulge there that's white, and it goes from rosy color just to white. Now, let's say you get rid of that filler and you dehydrate the lip. Now you go into the opposite end of the spectrum. So instead of ending up in kind of, let's say, peach, tan, whatever color skin you have, with a little bit of the vascular blush underneath, you end up looking dark. So after somebody dissolves, they can look slightly indented here, slightly more wrinkled and shriveled and dark. So the skin actually looks like it has a little bit of a mustache line. And that, again, can last for years. And that is where you look at dissolver, and when doctors say, you know what, this dissolver, you'll recover your own hyaluronic acid in a couple months, it's not true. When you dissolve those areas, I've seen patients 5 years, 6 years after dissolving, and they're still indented there. So your hyaluronic is not coming back. Sometimes it does, sometimes it doesn't. You cannot assume that it will. But the lack of hyaluronic in that area and the deflational effect of the SMAS makes it darker, I think partially because the dermis itself gets a little thinner and it gets matted down to the SMAS, which the SMAS, if you see, it's a very vascular structure. It has a lot of blood vessels in it. And you see the blood vessel coloration, meaning the color of blood. And then deep to that is the orbicularis oris muscle, so you end up seeing also maybe a little reflection from that. So there is a range of colors to think about with no hydration, whether it's from getting rid of filler or from just aging, where the lip skin here gets darker because it has less fluid in it, versus somebody normal, it has a nice skin tone with a little rosy color in it, versus filler, now that it's thick and it's drawing in water, it turns into a whitish discolored lip. When you get to fat and silicone, it's a little bit different. Fat can do the same thing and draw in water as it forms granulomas, or if it's a lot of actual fat superficially, you can get a yellowish tinge to this areas over here, and nodules in the pink part of the lip as well. Radiance itself, you typically don't see under the skin. You feel the nodules and it draws in water. And Sculptra, again, you don't typically see under the skin. It draws in water. Silicone, it can migrate more than a centimeter. So Juvederm is about a centimeter. Silicone can go about easily 2 centimeters. And that'll just hypertrophy everything, because you get granular hypertrophy, you get edema, chronic edema, you get lymphatic impairment, you get a lot of issues with silicone that makes the whole lip fatter, thicker, and you get a pillow of kind of cushion of pink mucosa that you don't typically get with Juvederm and those things. So either way, there is a large, I'd say, subset of patients who are negatively affected by filler from the coloration in their skin from the filler. So it's really important for doctors to know that the fillers, depending on where they're sitting and how much water they're drawing in or how much lymphatic drainage they're impairing, they can really cause a profound effect on the coloration of your skin, which does affect how you look, your skin tone, and really how you feel after fillers. So the whole world has kind of been going from thinking everything was caused by volume loss and volumizing everything, to now backing off filler slightly and saying, okay, we need to go more delicate, which I believe is the right move. So questions about filler: if I have lupus, can I have filler under the eye? I've injected patients with lupus, but every time I advise them that if you're somebody who your lupus gets set off by heat, your lupus gets set off by lack of sleep, by those things, then adding any kind of filler is going to induce a stress in your face, and it can cause a lot of problems. So you have to really kind of be in tune with your own lupus and know if you're somebody who's at risk. But yeah, there's certainly always risk. And let's say you are at risk and you put in filler, it's not just 6 months you're worried about. It could be 10 years. Fillers can last 10 years very easily in the face. Even though the clinical effect goes away after 6 months, you can have 10 years of residue, especially in the under eye and the upper lip. They tend to retain a fair amount. So we'll post this video. I'm not sure if anyone's interested in it, but certainly it'll help explain a lot of what patients have been seeing after dissolver or from excess fillers.
Blah, 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 blah.